Given the low number of cases in regional Victoria and the fact that our strategy there has been very successful, with the only due to the work that each and every country Victorian is doing, we can today announce that on Sunday we'll speak about two roadmaps towards opening up, one for metropolitan Melbourne and a second roadmap that may have different component parts for regional Victoria. That'll be based on case numbers. It'll be based on the science, the evidence and the best of medical advice. But we believe that, given the low case numbers, it will be possible for us to have different settings in regional Victoria compared to, and a different timeline, a different roadmap compared to what will be essential in metropolitan Melbourne, given the very different places in terms of the number of positive cases, the chains of transmission. The challenge is different in metropolitan Melbourne than it is in regional Victoria. We will always strive, though, to make sure that those rules are as simple and as logical as they can be. That's not easy, but we're confident we can strike that balance. Martin has joined us today. So Minister Pakula last night led a very significant consultation, the first on the roadmap out. It of course adds to many hundreds and thousands of meetings and different consultations that have been a feature of our response to this pandemic with unions and workers, with community groups and of course with business. It was a very successful session last night, and there will now be a series of industry-specific working groups breaking out of that, and I'll let Martin update you in a moment on that. But with a full week's additional data and the practical and really important input in a very contemporary sense from workers, from business, from community groups, we on Sunday will be able to give people a clearer sense of what the phases to come look like, what the weeks and months to come look like. And ultimately, this is all about making sure that the sacrifice, the pain, the amazing work that Victorians have done counts for something. There's no good doing this too fast, opening up too much too quickly, only to be open for just a few weeks and back in lockdown by Christmas time. We don't want that. We want to do everything we can to avoid that. So it's about a steady and safe easing out of these rules and then finding a normal that we can lock in for many, many months. Not, of course, to in any way confuse people. There will be further cases. There will be further outbreaks. But if we can drive these numbers down to the lowest possible level and then lock in a set of rules that are as open as possible, that's exactly what we have to achieve, and that's exactly what we will do.